Hello, this is Dr. Mukhtar Yerima. Welcome back to my channel. Today, I'm going to be talking about social anxiety disorder. Social anxiety disorder is also called social phobia, and it is a type of anxiety disorder that occurs in particular situations. In our previous video on generalized anxiety disorder, we mentioned that the anxiety symptoms occur everywhere, anytime, regardless of place or situation. Now, in social anxiety disorder or social phobia, the anxiety symptoms only occur in social situations. And what are social situations? Social situations are those situations in which the person with this disorder feels observed. So any direct social interactions in which the person feels directly observed is considered a social situation. So what are those examples of those social situations? Social situations include maybe dinner parties, public speaking in which he is the one who is speaking, maybe asking questions in class and he feels the eyes of everybody in the class on him, and board meetings and meeting strangers and expecting them to initiate conversations with those strangers, and also even performing in public. So if he is an artist, he is a musician, he is maybe a gymnast and he is expected to perform in public and he is being observed, all these can be considered social interactions or social situations. Now, people with social anxiety disorder experience their anxiety symptoms only in these social situations. So the symptoms of social anxiety disorder include having the anxiety symptoms that we mentioned in our generalized anxiety disorder video. They include having a feeling of fear, apprehension, worrying, and feeling a general dread for the situation. Also, there are the symptoms such as palpitations, and we talked about what palpitations are. It is the becoming aware of the beating of your heart, and then the heart might tend to be racing and beating fast. Then there is also the sweatiness, there is trembling, and there is blushing in people who are fair complexioned. There can also be drying of the mouth, especially in people when they are performing, when they are speaking in public. They might report to you that the moment they go up on the stage, they begin to have dryness of the mouth. They begin to see their hands trembling and they begin to feel completely incapacitated and unable to continue doing whatever it is that they are expected to do. So if it is public speaking, if it is asking a question in class, if it is meeting a stranger and asking them their number or something, they become completely incapacitated. And why is this? The reason why people with social anxiety disorder have these symptoms is because something in their mind, there is a thinking process going on in their mind that somehow tells them that they are going to be negatively evaluated. So in the minds of these people with social anxiety disorder, there is fear of negative criticism, or there is fear of negative evaluation from people whom they think are observing them in those social situations. Additionally, people with social anxiety disorder tend to have what we call anticipatory anxiety. Anticipatory anxiety is the feeling of fear and anxiety symptoms, or kind of dreading a forthcoming social interaction. So if the person knows that they are going to have a social interaction, maybe there's going to be a board meeting in the office, or there's going to be a kind of dinner party in the organization that he works, he is going to start having anxiety symptoms right from the time that he hears about the news, even before the meeting comes. So having those anticipatory anxiety symptoms is a significant part of social anxiety disorder. Another thing that occurs in people who have this type of anxiety disorder is what we call avoidance. People with this type of anxiety disorder tend to avoid all social situations, all the situations that bring on those anxiety symptoms. So they try not to make presentations. They will try not to talk in public. They will try not to attend dinner parties or any other social interaction in which they feel they are going to be observed directly and potentially be criticized. Or there are times when the individual might not be able to completely avoid the social situation. They will attend the dinner party, for instance, or they will go for the presentation, or they will go to the class, but they will avoid participating fully. So if they are expected to ask questions, they will not be able to ask questions so that the eyes of the class will not be on them. Or if they are expected to make a presentation in a group, they will make sure that they delegate those responsibilities to other members of the group. If he is a board member, he will not be able to go and make board presentations. So they will find a way of trying to avoid the situation completely. And if they are able to do that, they will. But if they are unable to do that, they will attend or they will engage in the social situation, but they will not engage in it fully. So we mentioned that the thinking behind social anxiety disorder in the mind of people who suffer from this disorder is the worry or the fear of negative criticism or negative evaluation. In their minds, people that look at them are not going to look at them favorably. People are going to see them as being terrible speakers. People are going to be harsh on them. People are going to generally criticize them. So of course, if you think that people are going to be critical of what you say or what you do, then definitely you might not, especially if you're a sensitive person, you might even not want to do it at all, right? So that is the kind of abnormal thinking pattern that goes on in the minds of people who have social anxiety disorder. So what are the problems? There are a lot of obvious problems. So at work, if your work is a type that involves a lot of talking with people, a lot of presentations, a lot of board meetings, then it is obvious that you're going to be incapacitated at work. Or you might find a way of dodging the presentations or the interactions, and then you might not really reach your potential. But imagine you are a bank manager, for instance, and you're expected to do board meetings, or you are a lecturer and you're expected to make presentations. Your work in essence depends on this. Then definitely you will be incapacitated if you are unable to engage in those social interactions. And then socially, the people with social anxiety disorder tend to have some social limitations. They may not be able to initiate conversations with strangers, and they might not be able to maybe ask people out, so they become socially limited as well. Another problem with this condition is that it results in serious personal distress. The individual who has this condition is so significantly distressed and so disturbed and so uncomfortable about the symptoms, but he cannot be able to help it, but he continues to have the distress associated with the condition. Also, people with social anxiety disorder tend to find ways of coping with the situations. And some people realize that maybe when they take alcohol, somehow they are able to boost their confidence, and that allows them to initiate conversations, to face the public, to perform their music, and to do all those social interactions that they ordinarily dread doing. So these are overall the symptoms of social anxiety disorder, or this is some of the things about social anxiety disorder. But thankfully, social anxiety disorder or social phobia is a type of condition that is treatable, and usually the only problem is to identify it. Most people know that they have these challenges, but the condition is somehow maybe not recognized as a medical illness, and so people just think that they are naturally shy, and because of that they tend to limit themselves and they are unable to reach their potential. So but if it is recognized as an illness and medical attention is sought, definitely it will be treated and the individual will go back to functioning fully. There are medications and there are also psychological interventions. The important psychological intervention is called cognitive behavioral therapy. In cognitive behavioral therapy, what the therapist will achieve is to try to correct those abnormal thinking patterns in the minds of the people with this disorder. So you think that when you talk and when you do something in public and people are observing you, somehow they are going to think of you in a negative light. Somehow they are going to evaluate you or they are going to criticize you. So those thinkings that are unfounded are going to be corrected by the cognitive behavioral therapist, and alternative thinking patterns are going to be taught to you, and these are life-changing treatments. So this is it for today. Thank you for listening.